Hi, everyone. Welcome back to Mad Barn Academy. And if you are new here today, then welcome. We hope to earn your subscription today. I'm Dr. Fran Rowe, one of the veterinary nutritionists here at Mad Barn. And today's topic is going to be on lameness examination. So lameness is one of the most common reasons owners call their vets, both in kind of emergency or non-emergency situations. So I wanted to go through the process of a lameness workup so that you can kind of know what to expect for the next time you call to set up an appointment with your vet to deal with some type of lameness. Let's start by defining what lameness actually is. Basically, a lameness is an abnormal gait or stance that results from a dysfunction of the locomotor system. In horses, the most common dysfunction is some type of musculoskeletal pain. However, lameness can also result from neurological or mechanical dysfunction, but generally less frequently. So, lameness is one of the most costly health issues in the equine industry, both in terms of the cost of diagnosis and treatment, but also the cost associated with loss of use, whether that be, temporarily while that horse is healing and recovering, or potentially indefinitely if it's something severe enough. So lameness can affect all types of horses of all ages, of all disciplines. So it's definitely an issue that many horse owners are familiar with, whether or not we want to be. Now, the goal of a lameness exam is really to figure out what the inciting cause of that lameness is so that we can treat it appropriately. Sometimes it's really obvious, right? That horse is limping, there's a wound, there's swelling, etc. In other cases, it's not so obvious. The lameness maybe is really mild, it's inconsistent, or maybe it just presents as a kind of performance issue and we don't initially realize that it's a true lameness resulting from some type of pain or other issue. The lameness exam is a methodical process that helps the vet determine where the lameness is coming from and what structures are involved. We can break down this exam into three kind of big categories. Recognition, where we are seeking to determine which limb or limbs are the source of the lameness. Localization, where we isolate that lameness to a particular region of the limb. And then resolution, which is the last phase where we are going to want to develop an appropriate treatment plan to address that lameness. In the majority of cases, your vet will follow this step-by-step process to isolate the lameness. Of course, not all of these steps are necessary in every single case, but this gives you an idea of what to expect with kind of the normal progression of an appointment and lameness workup. So let's go through each of these steps in more detail. Our first goal is to determine which limb or limbs are the source of the lameness. So, recognition. Your vet will first start by gathering a history. So they'll be asking you a lot of questions to kind of get some background on what's been going on. When did you first notice the lameness? Has it gotten better? Has it gotten worse or stayed the same? Have you tried treating it or doing anything to resolve the lameness yourself? And does this horse have a history of lameness? Does it have old injuries, or do we know that it has arthritis or a history of laminitis, etc.? Next, they'll proceed to a physical exam, looking at the horse and palpating the horse all over, kind of while the horse is standing at rest. So, as your vet is approaching the horse, they're going to make an assessment of how that horse is standing, or if any major abnormalities jump out, like swelling or a wound. Some of these abnormalities might already be obvious to you, the owner, as well. But if nothing's obvious from afar, then your vet will do kind of a hands-on palpation of the body, going over the neck, the back, and all of the limbs, also applying hoof testers to all 4 feet to see if there's any hoof sensitivity. They're going to pick up the limbs and kind of assess a passive range of motion as they kind of bend and flex. Um, and really the objective with this part of the lameness workup is to attempt to identify, any major clues, any heat, pain, swelling, sensitivity to hoof testers, reduced range of motion anywhere, the presence of digital pulses, or anything else that is really going to start to point us in the direction of where this lameness is coming from. Next, the vet will want to watch your horse go. Now, it's important to note that if the horse is severely lame, then your vet will forego a motion exam so as to not cause any further injury to the animal. Generally, determining the affected limb or limbs is pretty obvious if the horse is really severely lame, non-weight bearing, something like that. But in all other cases, the motion exam really helps us determine or confirm which limb is the problem, as well as kind of characterize how severe that lameness is, so we can actually put a number on it. So your vet will want to kind of recreate the circumstances in which that lameness becomes evident. That is usually achieved by, trotting the horse in hand on a straight line. Both on hard and soft surfaces is helpful. Also, trotting in a circle, whether that's on a lunge line or kind of round penning, but also that might mean watching the horse go under saddle or hitched to a cart, whatever is applicable for that horse's job, in order to make that lameness evident so that we can see it. Now, a front limb lameness is generally identified by the presence of a head nod. Kind of the little term is down on the sound, where that horse's head kind of goes down when the non-lame limb is on the ground. A hind limb lameness is generally identified by a hip hike, but also different metrics like stride length and kind of flight of arc of the limb, and drifting and tail carriage can also kind of help ID hind limb lamenesses. And then also your vet will listen to the evenness of footfall, particularly on a hard surface like concrete. If a horse is sound, they're going to have even or symmetrical footfall. If they are lame, then there's going to be an asymmetrical sound to their footfall. To characterize the severity of lameness, your vet will use the lameness scale outlined by the American Association of Equine Practitioners, or the AAEP lameness scale. So there are 5 different grades. You can kind of exclude grade 0, which is essentially the horse is not lame. But grade 1 is mild, and then all the way up to grade 5 is most severe. So a grade 1 lameness is defined as one that is difficult to observe and is not consistently apparent, regardless of the circumstances. So whether that's under saddle, circling, on an incline, hard surfaces, etc., that lameness is really inconsistent. A grade 2 lameness is defined as one that is difficult to observe at the walk or when trotting on the straight line, but it becomes consistently apparent under kind of those special circumstances, whether they're weight carrying, that's either under saddle or like with a surcingle, circling, inclines, hard surfaces, etc. So grade 2 is still fairly mild, maybe a little bit difficult to pick up on just under kind of those normal circumstances. But when you start to kind of stress the horse and put that horse into special situations, it becomes more apparent. A grade 3 lameness is defined as one that is consistently observable at the trot under all circumstances. So these are the ones that are fairly easy to pick up just on the straight line. A grade 4 lameness is going to be obvious at the walk. So you don't even have to trot the horse to see it. You'll see it as you're walking out of the barn or out of the stall. And then a grade 5 lameness is a lameness that produces minimal weight bearing in motion, or that horse is non-weight bearing at rest or is just completely unwilling to move. So obviously the most severe of lamenesses. Okay, now that we've determined which leg is the problem through kind of the early part of our exam, our next goal is to isolate that lameness to a particular region of the limb, localization. After watching the horse go in hand, your vet will then proceed to flexion tests or kind of limb manipulation tests. Your vet is going to hold the limb in a flexed or extended position for anywhere from 30 to 60 seconds, depending on the region. Then the horse will trot off in a straight line. So usually this is going to be done kind of wherever you are doing your straight line in hand trotting for the motion exam. And usually the vet or a helper is going to count you down from 5, 4, 3, 2, 1, trot, so that the handler knows to go ahead and trot off once the vet drops the limb. So your vet may perform both lower and upper limb flexions on all 4 limbs, as well as a stifle extension or a stifle crossover manipulation. Lower limb flexions are meant to stress the fetlock down, so the fetlock in the digit. Upper limb flexions are meant to stress the joints above the fetlock. So in the front leg, that's going to be your knee and your elbow. And then for the hind limb, that's going to be hock stifle hip. And then stifle extension or that crossover is meant to stress the stifle more specifically. Now, flexions aren't a perfect science, but they do start to help us isolate that lameness to a particular region. Your vet is looking to see if the lameness worsens after a particular manipulation. The reason the test would make the lameness worse is that because it stresses the joints and the soft tissue structures associated. So if there's some type of injury or other issue present in that location, that kind of extra stress or tweaking is going to be a little bit more uncomfortable when the horse first trots off. So when we do these manipulations, we're putting tension or compression on the soft tissues or the surfaces inside the joint. We're increasing pressure inside the joint, and we're kind of constricting blood flow when we're kind of holding in a really tight flexed position, and we're kind of stretching the nerves a little bit. So all of these things are meant to kind of put stress on that particular region of the limb and make that lameness temporarily more apparent so that we can see it. So after our flexions, next your vet may want to perform what's called diagnostic anesthesia to further isolate or go ahead and confirm the region to which that lameness isolates to, if the flexions kind of gave us an idea. You probably know these better as nerve blocks. And so what your vet's going to do is inject a small amount of a numbing agent, usually carbocaine, around the nerves in the leg or potentially directly into a joint. And just like when you go to the dentist to get work done on your teeth and they numb you up, it's the same concept. This is going to temporarily numb the structures innervated by those nerves. So when performing nerve blocks, your vet will start from the bottom of the limb and work their way up. Everything below that point of numbing will become numb. So we want to start from the bottom so that we can kind of isolate these regions individually as we work our way up. And that helps us kind of isolate more accurately. And there are a lot of different blocks that can be performed, whether that's perineural or the nerve blocks or into a joint itself. Usually, your vet will only do 3, maybe 4 max in one day. Um, so sometimes for really complicated cases, you might, a lameness exam or workup might stretch over 2 days, or they come back to continue working it up. Now, if the horse at any point during this blocks out, i.e., trots sound after being blocked, then the source of the lameness is going to be isolated to that particular region that the block targeted. Last on our list for a lameness workup is diagnostic imaging. So once you've isolated the lameness to a particular region, then using x-rays or ultrasound will help your vet reach a definitive diagnosis, or at least hopefully allow you to reach a definitive diagnosis as to what exactly is causing this lameness. And that's going to help guide your treatment plan and also guide your prognosis, which is important for performance horses. So, in some really tricky or really complex lameness cases, advanced imaging like CT, MRI, or a bone scan may be needed, but this is something that your vet would discuss with you if all the other steps of your lameness workup are not yielding a diagnosis. All right, now we're on to the final leg of our lameness workup, which is resolution. So obviously there are many, many, many causes of lameness in horses, and the treatment plan is going to completely depend on that underlying cause. So when we think of some of the causes of maybe more mild to moderate lamenesses, kind of things that might be on the list are going to be hoof abscess, laminitis, navicular syndrome or navicular pain, any type of osteoarthritis coming from any joint or potentially in the neck. Soft tissue injuries like a bowed tendon or some other injury to the suspensory ligament, superficial digital flexor tendon, or deep digital flexor tendon on the back of the leg. And then maybe something like a muscle strain. Some causes of more severe lameness, so these, kind of non-weight bearing lamenesses, also can include a hoof abscess, also can include laminitis. And then other kind of really more serious things like a cellulitis, which is an infection of the dermal layer of the skin. Horses are very prone to cellulitis, especially if they get a nick or a wound on a leg, but they can become very, very painful. Certainly something like a synovial infection. So that's a bacterial infection into a synovial structure, whether that's a joint or a tendon sheath or a bursa. And usually these come from penetrating wounds that affect that synovial structure. And then, of course, kind of the scariest is going to be something like a fracture. So it is important to note that these examples that I've given are not written in stone. Some horses or some cases will surprise you and be more lame or less lame than expected, kind of once a diagnosis is made. But these are just sort of some general rules of thumb. Okay. And like I said, depending on the underlying cause, the treatment plan might include some combination of the following: rest, cold therapy or cold hosing, compression, bandaging, systemic anti-inflammatories, or joint injections, antibiotics, other medications as indicated, therapeutic shoeing, complementary modalities like shockwave therapy or laser therapy, and then even potentially surgery, depending on what's going on. All right, you guys, that wraps up the totality of lameness exam in horses. There are a lot of different steps, and these appointments can sometimes take a long time, but hopefully you'll feel kind of more prepared for when you need to call your vet to set up an appointment to work up a lameness. So here are references for today, and I really appreciate you taking the time to listen. Don't forget to like and subscribe to our channel. Explore the other videos we have up, and we have new stuff coming out all the time too. So check back regularly. And don't forget to check out the additional links that I've provided in the description of the video below. There's some supplemental materials on just lameness exam in general, which kind of covers exactly what we did today, but also some more in-depth discussion on flexions and then diagnostic anesthesia too, if you're curious. So check those out, and be sure to check back soon for another video. All right. Thanks so much. Bye.